We have been seeing lots of common colds and a lot of different viruses. We're definitely in the last week and a half seeing much more of RSV, which is the respiratory syncytial virus. And we're seeing a lot of flu as well. I would say that we're also seeing a lot of complications of those viruses that occur 2 or 3 weeks later. So things like ear infections, and some of our younger children are also getting pneumonia. So it's very common that all of us who pick up this virus have a little bit of runny nose and cough, maybe a low-grade fever. The concerning symptoms that parents really need to watch out for would be persistent cough that's interrupting sleep, wheezing, trouble breathing. So oftentimes we'll show them which muscles to look at. So you always want to raise your child's shirt and look at their chest to make sure that they're not breathing too fast. Sometimes you can even see nasal flaring. So the nostrils will flare in and out consistently. And those are the most serious things that we look for. Sometimes some kids will have a little bit of weird noises that they make that are really scary sounding. So those are the things that we should look for. And in those cases, the kids should definitely be evaluated. Fast breathing can be a symptom of fever only. So we always encourage parents to give their children Tylenol or Motrin if all they have with a cough that's mild is a little bit of fast breathing. So if you give Tylenol or Motrin and the breathing sort of settles down within half an hour, then it came from the fever. But if that breathing is persistently fast, no matter how much Tylenol or Motrin you gave, and it's still there, an hour before, then we definitely are concerned and we want you to bring them to our attention. Usually RSV is treated with what we call supportive care measures. So things like cleaning their nose and nasal suctioning and applying saline spray or drops up their nose and trying to get as much of that mucus out as we can, and using a coolness humidifier, especially when they're sleeping. The symptoms always seem to be worse at night when the child is asleep. And so it's very important to get that humidifier close to their bed, try to suction, and then keep them comfortable. So usually that means a little bit of ibuprofen or acetaminophen, and make sure that they're really well hydrated. As far as, breathing trouble when they come to the emergency room for those types of evaluations, and those cases we give them oxygen, we clear their airways really well. Sometimes we'll try some breathing treatment, and it's not a big surprise if some of those breathing treatments don't work. So sometimes we will support their airway by putting a tube down their throat to help them breathe. And so those are our kids who end up in the intensive care units, and they're hospitalized for a few days. Hand washing is always our number one recommendation and the best preventative measure, even for our smaller children. For babies, we definitely want to wipe down their toys as frequently as we can, and we want to make sure that we're not around others who are actively sick. So during the pandemic, we were all great about social distancing and isolating while we were sick, and we were really good with wearing masks. And so the viruses, we just simply didn't see a lot of them, if any. I would say I remember one year during the pandemic, I only saw flu like one time the whole flu season. So it's very important to talk about viruses do mutate and they do become stronger and more aggressive. And so that's kind of what we're seeing right now, is that RSV, we're seeing it a little bit earlier than we did pre-pandemic. And the cases that we're seeing in clinic are just kids are just more sick. So we're seeing a lot of our younger kids who are ending up having the difficulty breathing and going to the emergency room, and some are being hospitalized. So the pandemic has definitely had an impact, and the viruses have gotten a little bit smarter and a little more aggressive as well.